A warm welcome to today's talk. It's still Wednesday, the 24th of August. Now, today I want to look at the fact that, as I interpret things, the acute phase of the pandemic is basically coming to an end now. Cases going down in the UK. United States is just following. For example, hospitals in the UK next week won't be testing people that are asymptomatic when they're admitted, which is a major step towards normalisation, really, of the endemic SARS coronavirus 2 now. And we anticipated this some months ago, that sooner or later hospitals would have to stop testing, and that's happening next week. And I'll also be answering some of your concerns about what's happened to the channel over the past few days as well. Certainly appreciate the concern that's been shown. Now let's just start with a bit of orientation to what's going on. These are cases, of course, per million. South Korea and Japan, well, these are quite high, as is Taiwan, but Taiwan has come down. So Taiwan's kind of got over it, over the Omicron wave, but Japan and South Korea are still going up. Now, of course, this is largely a product of the fact that they're still testing, and most of us really aren't testing that much anymore. And when we look at hospitalisations, we do see an increase in Japan with the elderly population, with United Kingdom hospitalisations going down, Australia hospitalisations going down quite nicely as well. United States, they're going down slightly. Canada, they're more level-ish, but Japan really, having missed out on the first part of the pandemic, is kind of making up for it now in Omicron times. Although, as we'll see here, nothing like as many deaths. Now, there hasn't been a sudden decline in UK deaths. For some reason, our world in data is not fully picking up all the deaths that are happening, but they are happening, albeit to a lesser extent. United States highest, the United Kingdom second, Germany, Canada, Australia, South Korea, Taiwan, New Zealand, and Japan, all with much lower death rates. Now, in terms of what's going on, this is the Zoe Health study data, which I want to look at first of all. Cases are going down basically quite dramatically. Still 1.6 million people with symptomatic COVID there in the last week. But when we look at the numbers, we do really see a very satisfying reduction in the numbers here. Now, this has been going down, so they're the dates there. So that's June, July, May, June, July there. So the numbers have been going down quite dramatically here, and they are levelling off a bit now. So I would expect that to carry on going down towards the end of summer, although the fall is not as quick. Now, why am I being optimistic about this? Here's the nowcast from the United States for the variables. And we see that the BA5 basically has taken over. Okay, there's some BA4s there as well. The BA2 has been squeezed out. The BA1 no longer exists, at least in US data. And the encouraging thing is, while we see that the BA5s replaced the BA2 12.1 and the BA2 12.1 replaced the BA2, and the BA2 has replaced the BA1, and the BA1 replaced the Delta, and the Delta replaced the Alpha, what we're not seeing is any new variant coming up. So I'm quite optimistic that immunity that is increasing at the moment to BA4 and BA5 is going to become more prevalent, but we're not really seeing a new variant coming along. Now, this could change dramatically if a new variant does come along, but one that has more immune escape than BA5 has had, and one that is more transmissible, is a little difficult to... It's hard to imagine what a variant that's more transmissible, because these Omicrons are already immensely transmissible. So it could well be that the BA5 could be the last significant variant. That is within the realms of possibility. There'll be minor variants after that, but by that time, with the virus being more endemic, we'll have high levels of immunity, which is why I'm optimistic. This latest ONS date, UK viral positive prevalence, what have we got? Well, we see it's down a fair bit from what it was. So England 1 in 40, Wales 1 in 40, Northern Ireland 1 in 50, Scotland still 1 in 30. So, for example, here's the English trend here. and we see it going down really quite nicely. This will be further down next week, although not as steeply, because we know that from the COVID symptom tracker data. Scotland, likewise, quite a sharp fall in Scotland actually there recently that we see. That's the Scotland data there. So again, this will be down next week, albeit not quite as much. It will be kind of about there next week. Now, another reason for optimism today is the risk of reinfection. It was 5 times higher in the period when Omicron variants predominated. So Omicron, of course, much more reinfection, compared to the Delta period when there was less reinfection. But risk of reinfection in the early Omicron period was 10 times. People were 10 times more likely to be infected. Now it's nearer 4 or 5 times more likely to be infected. So we're getting less reinfections, indicating that there's an increase in the amount of immunity being developed to BA5. And as we see that BA5 is the major variant there, then that goes together to make, I think, fairly encouraging news. Now, this is the overall hospitalisations in the UK here. Hospital admissions, so they're on the way down. Because infections are also on the way down, this will carry on going down. This number here along the bottom, of course, is the intensive care unit admissions, which have thankfully been low throughout the Omicron period. We saw them going down here at the start of the Omicron period and have stayed reasonably low. Now, this is really interesting. This is a new graph from the Office for National Statistics. This is basically people in hospital for COVID or with COVID. So the number of people in hospital primarily because of COVID here, we see has dropped way below 50%. So there on about the 4th of January, it dropped below 50%. Now it's what? It's around about 40% there, is it? Probably around about 40% from that graphic. And these different lines here are different regions. So, for example, this one, where more people in hospital are admitted for COVID, I think that one was the southwest. This one here is the London area, where there's more immunity because cases were higher in London earlier, therefore it's developed immunity quicker. So I think the rest of the country is going to go more the way of London. So basically what this means is now we have this large amount of people here, about 60% of people in hospital with COVID, who for basically it's an incidental finding, and only 40% are there for reasons of COVID. So I think that's another reason for really quite significant optimism, really. That's carrying on going down. And the figures are probably even lower for intensive care than that as well. That's the UK official data site. I'm not going to look through that at the moment, but it is overall encouraging. Now, US variants, the reason I'm using the US variant data is it's much more up to date than the UK one. The UK one hasn't been updated since the 22nd of July, I think, so it's way out of date. We would expect this every month, but it hasn't come up, so we're still waiting for that. But the United States one is more up to date, and we'll just remind ourselves here. BA5 basically 90%, BA4's about 10%, but as we see there, it's the BA5 that's predominant, although they are remaining of some percentage. The BA4s, BA2 0%, BA1's 0%, Delta 0%, and of course Alpha and wild type Wuhan strain 0%. And generally the United States, things are going down. Now the United States is going down a week or two behind the UK, but the trajectories are currently good. Cases down, this is the last 2 weeks, nearly all states down about 16% is the overall reduction figure. Now test positivity is still 15%. It is down slightly, it was 16%. Some figures actually still say it is 16%. Test positivity, of course, is the number of cases that are coming back positive for every 100 tests done. And it's more likely to be a representative indication of how prevalent the virus is. So still pretty high numbers, but that's what we had in the UK a fortnight ago, pretty high numbers. So it's not surprising that it's still high in the States, and that's probably about the best indicator that we have. for the overall prevalence in the States, because the testing is poor and there's not the national surveys like we have in the UK, like we have with the Office of National Statistics. Hospitalisation is a bit more patchy, down 8% for the country as a whole in about half of states, but overall still down 8%. And I am confident that these will continue to go down as the United States follows roughly the trajectory of the UK with a bit of delay. Now, this is the COVID patients in hospital and ICUs in the States. So this is the hospital ones here. So we're seeing this starting to go down now. So pretty encouraging that that's starting to go down. And because the cases are down, I would expect that to continue. Intensive care admissions in the States, probably roughly level to going down very slightly. Of course, more comorbidities in the States, which predispose to, unfortunately, more severe cases. Deaths in the States actually down 5%. So NHS no longer going to be testing. Cases down. Symptomatic cases down. ONS survey cases down, pretty optimistic. Now, I was just reading some data from Australia, from I think it was from one of the states in Australia. I think it might have been South Australia. They're anticipating a bit of a surge in November. That's possible. Of course, that would be coming into their summer, so of course, Australia's hot, so people often use air conditioning rather than like the southern United States. There's probably going to be a bit of an increase in cases in autumn in the UK and in Europe and in northern United States and in Canada, for example. The cases are probably going to go up, but I think that'll come up against quite a lot of immunity. The question is, how much will immunity wane? That's going to be the main factor determining that, unless there's another variant that really outcompetes Omicron BA5. But, well, I've been surprised before, but I would be surprised if this is happening. And a certain Dr. Fauci, who's 81 years old, is retiring in December. He's been in the National Institutes of Health, this bit here for the National Institute of Allergy and Infectious Disease since 1984. And his departure will be met with a mixed response. Now, lots of concern about the video that was taken down recently from my channel. So what happened was, there we have it there, video was removed by YouTube a few days ago. I'm not telling you what it's on, obviously. Terms and policies was violated, sadly, by me. In the 24 hours or so it was up, it got 319,000 views. It did have several thousand comments. They've now been taken down, unfortunately, as well. And it had nearly 20,000 likes with 98.7% likes versus dislikes. But this video has now been taken down. The reason for this was YouTube adjudicated that it violated community guidelines. So and these community guidelines say that I can't say things that are contrary to localized COVID regulations, and I can't say things that are contrary to the World Health Organization protocols, teachings, whatever you want to call it. So my unreserved apologies if I've misled anyone. I've been found guilty of that, and I have to accept that verdict. So if I've misled anyone, my unreserved apologies. It appears I've said things which are, well, YouTube have adjudicated I've said things that are inconsistent with UK government guidelines and World Health Organization guidelines. This does put me in a bit of a dangerous situation, really, because I've been doing videos for a long time now. I just ratcheted out a random one here. This is one of my early ones. This is when we went from VHS tapes onto the mini tapes before we went onto DVDs. and then of course before we dematerialised onto YouTube. But the point is, before COVID started, I had about 900 videos on where I deal with basically everything, all of the systems of the body, all the anatomy, all the physiology. They're all still there, of course. Virtually all of the diseases, all the common diseases anyway, lots of clinical procedures, basically all the things that all my student nurses were taught over 27 years, and things that are good for anyone starting off in physiotherapy, medicine, pharmacology, dentistry. I get lots of feedback from all of these people, and hundreds of institutions, and still getting tens of thousands of views around the world as students use these, often in combination with the books. So the videos are based on the books, the physiology book and the pathophysiology book, and much more detail than those. And of course, these are available for free. I might post the link again. Actually, I haven't posted it for a while, but you can download these free now as PDFs, because we want to make them as widely available as possible. So my big concern is that if there was a problem with the YouTube channel, that all these resources that people around the world are still using to teach students could be at jeopardy. So that is causing me some anxiety, but we'll hope it works out well, and I'm certainly going to be careful not to breach YouTube guidelines. So I certainly wouldn't want to contradict World Health Organization protocols, dictates, whatever the World Health Organization policies. So that was what that strike was about. So you're up to date as I am with the current pandemic. Hopefully this pandemic's going to carry on diminishing. We've been looking at other interesting medical topics. We've looked at monkeypox. We've looked at other infections. What else have we looked at? We've looked at quite a bit on depression over the past few weeks, and of course there's any amount of other things that we can consider in terms of public communication of health related matters. So thank you for your patience, thank you for all those that did express concern about that. That was the story, and thank you for watching this video.